Mrs. Baldwin, you are the Director of Public Social Services for Riverside County. Your department is responsible for family, adult, and children services ranging from CalFresh to Medi-Cal. So much falls under your purview. I'm curious if you could speak more about the depth of public services offered in the county and just how many people need these very services both before and right now during the pandemic.
Well, first of all, I want to thank you for the opportunity to talk about our important social services programs. And as you said, our services that we offer, of course, is wide in terms of the number of people that we serve. So in any given year, in Riverside County, we serve approximately 700 to 900,000 individuals throughout the year. And so I just want to provide you with a very high level overview of our programs, starting with our self-sufficiency programs. So as you stated, our self-sufficiency programs are considered work support programs. And so these programs are for low-income families, and it gives them the opportunity to access healthcare through our Medi-Cal program, CalFresh, formerly known as food stamps, our CalWORKs programs, which is our cash assistance programs that offers not only cash aid, but also homeless assistance, childcare, and importantly, our welfare to work programs. And then our final program within our self-sufficiency programs is our general assistance programs, which offers a small cash assistance grant for individuals that are medical or that are indigent. And so those are our self-sufficiency programs. And then we have our child protective services programs. And the department becomes involved in child protective services when we receive a call at the hotline that reports suspected abuse or neglect. So our department is responsible for investigating, but also to the extent possible, stabilizing families that may be in need of our services. We also offer foster care services in which we have dependent children that we are responsible for. Our third large program is our adult protective services program. And we are responsible for alleviating or preventing physical, sexual, and financial abuse for adults and dependents. And then finally, we have our in-home supportive services program, which provides home care assistance to elders, dependents, and adults and minors with disabilities. And the goal really is for those individuals to live safely in their home and in a non-institutional setting. So that's a very high level overview of our social services programs.
Wow, it does. It covers so much. It's amazing when you think, you know, the children's and the, I mean, homeless is just all under one big umbrella. So that's a lot for one department to be and one person to be responsible for. I'd love to talk about a little bit more current events, you know, amid this pandemic and following Black Lives Matter protests this summer. Many Americans are calling for a greater portion of government budgets to fund social services. As we're hearing, it covers a lot. If money was reallocated, let's say in the next fiscal year or in the future, what would the county or even the country look like if we were to make social services a higher priority?
Well, first of all, I wanted to say we work very closely with law enforcement, but there's also overwhelming research regarding the outcomes of children, particularly those children who grow up in poverty. And so in social services, if money were reallocated, what we've been looking at is preventative services programs and preventative and supportive services programs. And we would increase and wrap services around communities that are in need. We would also look to reduce the number of our staffing to caseload ratio. And really the goal in that situation is to provide the time and therefore offer quality services for individuals in need. I will say that our Board of Supervisors have been very supportive in supporting social services programs and with the goal of focusing on the two things that I've just talked about, increasing preventative services along with decreasing our staffing ratios.
Perfect. And do you see, has this been the attitude, the mood for a while now, and maybe these times are just shining a light on it? Or have you maybe during such chaos and so much going on, have you seen a shift within your department, or have you been focusing on prevention?
Well, when we'll talk a little bit more throughout this podcast. So it's kind of the perfect storm happening right now. So in the midst of the protest, the bottom line is we have a pandemic going on. And we know that individuals are losing their jobs as a result of, folks not going to restaurants to eat. And when we look at our low income the working poor, those folks are really the ones that are in crisis right now. And so anytime our economy suffers, so does the needed services in terms of we need to support our low income worker. And so with that dynamic going on, again, we have two things: your social awareness in terms of disparity, and then we have our businesses shutting down that are impacting. So for me, it's really just the perfect time to relook at how we can support the individuals and support the working poor. So has it always been a priority? There's always been a fight for scarce resources, and every budget year, our policymakers have to make the decision regarding where funding goes and where both services are needed. For me, because I come from a social services setting, and I really do think that community service and preventative services should always be the key in order to alleviate the problems of society. Yes,
of course. I wanted to ask, this is something I personally am curious about, and I know some professors at UCR, the School of Public Policy, I've looked into a bit. Do you believe there is a stigma surrounding social services? Let's say a working poor family or an individual who is struggling, if they need help, do they do their research and find out if they're eligible, or do they think, oh, that's welfare, they don't want government help? Do you think everyone who needs help actually, looks out for themselves and does their research and gets that help?
Well, over the years, we have worked on a number of marketing strategies to hopefully alleviate the stigma attached to our social services programs. But I absolutely still believe that there is a stigma attached when you think about individuals, particularly our seniors who are on a fixed income. So what we do is we look at our poverty rate and we compare it to the number of people who access our services. And for our elderly, we don't want those individuals needing to make a decision on, do I pay my rent this month? Do I pay for, a medicine that I can't afford? Do I buy food? And so we still have many individuals that don't access our services that are eligible. And we know that just based on comparing our poverty rate to the number of people who receive our benefits. And so, I'm hoping that individuals will understand that these individuals have paid their dues and have paid into the system. And if they're eligible for benefits, our goal is to service them to the extent possible. But yes, there's still a stigma attached to individuals receiving our services.
I'm sure, and I hope, over time that that percentage goes down. I hope, people don't have to make those really, really tough sacrifices and choices. especially since we do have programs that could help them. Back, we had just talked about the COVID-19 recession, and how that's impacted so many people from food, housing, and employment in the US and across the world. We were talking about how poverty is a great concern, and your department houses assistance, as you talked about at the beginning, nutrition, housing, as well as employment and homeless programs. As of right now, our programs in Riverside County, or even the state, or the country, we're in changing times right now, but are we prepared to continue aiding constituents facing such hardships in this new year? Do we have the resources and the money?
I wanted to illustrate in this slide is prior to the pandemic, around February or March, if you look at the yellow number, and then you have a blue number, the top two numbers. If you look in Riverside County, prior to the pandemic, it shows the number of individuals that apply for Medi-Cal and also CalFresh benefits. And so what this slide represents is in January for Medi-Cal, we receive about 14,000 applications a month. And then for our CalFresh benefits, we received about 13,000 applications a month. So then when COVID hit and business started shutting down, you can see that our CalFresh applications jumped to about 21,000 applications a month. And then for Medi-Cal, it pretty much stayed steady, about 14,000 applications a month. And then you can see when the stimulus check first came in, where our applications for CalFresh went from the 21,000 to 14,000, but you can follow the trend in terms of our services. And so the best way for me to illustrate the impact of COVID and the pandemic, I will start off by saying in Riverside County, we serve a large number of individuals who are considered to be the working poor. So if you can just picture a family who works at a minimum wage job at $12 an hour, and let's say you have a mom and she has 3 kids. She works 80 hours, 160 hours a month. And you know what her income is a little over $1,900 a month. And if you look at the average rent and the lack of affordable housing in Riverside County, these individuals, now just think if you have to pay for health insurance, purchase food, pay for childcare, it's difficult. And so now with the pandemic and these low wage jobs being impacted, they're either shutting down or they're not offering full-time employment. Our families are being devastated. And so things like the stimulus check, it's just a temporary solution to help individuals get over the hump. And then we offer our Medi-Cal benefits, our CalFresh benefits, cash assistance if needed, in order to temporarily help individuals. And so these are very complex issues, and we have short-term, and long-term strategies. So your affordable housing, that issue in Riverside County is not going to be resolved overnight. And so we work with our community partners in order to look at how we can supplement individuals' housing needs. And so I'm hoping I answered your question, but I'm hoping that this visual will show you how our programs are directly impacted by the economy.
So the COVID-19 pandemic has shined a light on public health, of course, as well as private versus public health care in this country and employer-based insurance. As unemployment skyrocketed in 2020, what, if any, effects did you see in healthcare assistance in Riverside County?
So our Medi-Cal programs by far has always been, actually for the last 10 years, our largest program. So prior to the pandemic, even looking at the chart I just showed, we took about 14,000 applications a month. And so what it tells us is that in Riverside County, again, you have a large number of people who are in need of health insurance. And so it's an interesting dynamic in terms of those numbers. Our applications pre versus post pandemic has pretty much been the same. But on the other hand, we're not surprised, because usually what happens is that people access health insurance usually when they're in crisis. So if you go to the emergency room and you don't have health insurance, particularly at our county hospitals or our clinics, we automatically take a Medi-Cal application there, because we don't want people not accessing services because they don't have health insurance. And what happens in society is people usually go to the doctor when it's an emergency. And so for us, the goal, again, for any health insurance is preventative services, that you go to the doctor when you have a cold, or for example, if you're pregnant and you need prenatal care, and that you don't wait. That's usually not how it works, because some people are just nervous and they don't go to the doctor until it becomes an emergency. And so it's important, again, that we offer these preventative services, and that people really understand the services that are available to them based on their income levels.
That's wonderful. As we're reaching the end, I know we've been talking a lot about maybe more on the side of adult or family services, but I'd like to touch again on the children's services that you spoke about at the beginning. We have been, talking about parents and caregivers who have been facing, especially financially, struggles. But from a public administrative standpoint, have you noticed a difference in children's social services needs? On this podcast, we've talked a lot about, education from home, the digital divide, but, are you getting more phone calls about neglect or abuse or children, their mental health, just anything, just being, stuck at home right now?
Yeah. Well, thank you for that question, because that's one of the things that we're worried about is when we come out of this pandemic. So what we know for a fact is that families, adults are losing their jobs. We also know that children are at home isolated, and so are, parents. And so if you couple, financial crisis with isolation, it sounds like a recipe for disaster. And so when the pandemic first hit, first of all, I will say our number one caller to our child abuse hotline are teachers. They're the ones prior to the pandemic that would have their eyes and ears on kids. And so when the pandemic hit, our hotline calls for abuse and neglect decreased by about 20%. So we saw the numbers going down, and as we move, we're about 9 to 10 months into this pandemic, our number of hotline calls are going back up again, and school's not in. So we're just trying to figure out, what that dynamic looks like. Over the last 10 months, we've engaged in a very aggressive marketing strategy in which not only did we engage with our teachers, but also our communities to keep their eyes on our kids. And so if you have neighbors, the schools, they're doing virtual classroom setting. And so you're not always going to see a bruise, but we're just talking about, just pay attention to particular signs in terms of attendance, engagement, and our goal really is to educate the community to say this is a community responsibility to ensure that our children are kept safe. We worry about kids, particularly who do not have the resources. So the school district can issue a laptop but if you have a low wage worker and mom has to be at work because she's not afforded the opportunity to telework, that means that that first grader or kindergarten may be at home, you know, trying to access the computer and you know, they're going to school, maybe without supervision. We have children that, you know, where learning is difficult, you know, for any average, you know, you're a college student, I'd be curious to see how virtual learning has worked. And can you imagine being a first grader, second grader, third grader, and you don't have dedicated space to learn, let alone the supports necessary? And so those are the things that we are really working with our community partners to ensure that we do everything possible to assist these families that have the greatest need.
And I think it's so important. I talk with my friends all the time. College already has somewhat of an online setup with, you know, course materials and assignments and submissions. So, you know, the transition wasn't as difficult for us, but for K through 12, you take recess away, you know, you take after school programs away. And what if they don't have a computer at home? Or what if they don't know how to access it, or there's a language barrier, or there's just so much going on that I've thought about a lot. I'm very interested in education policy. So I'm so glad to hear all the work you're doing at the department. And I only hope, you know, when K through 12 or in school in general goes back in person, that, you know, we just help meet those needs again with yet another transition. So talking about helping, for those watching or listening who may be struggling with any of the topics we've talked about or you mentioned that are covered under your department, do you have any suggestions for where they can find help or assistance, or if they're wondering if they're eligible, or if, you know, there are services they may not know about?
Oh, thank you again for asking that question. So the easiest way is you can Google Riverside County Department of Public Social Services, and it will link you to our website, and it will give you a overview of all of our programs. But if you're interested in applying online for any of our social services programs that I talked about today, you can go online, and the website is c4yourself.com. You can also call 877-410-8827 to apply for any of our social services programs online. If you suspect any child abuse or neglect, you can call our hotline at 1-800-442-4918. And then I'll leave you with one last number. If you suspect any elder or dependent abuse, you can call us at 800-491-7123.
Thank you so much. I will make sure I do my best to link all that in the description and show notes below. So hopefully that will just be an easy click for anyone if any of this seems like they want to use and utilize any of that. Director Baldwin, I just want to thank you so much. I think people are going through so much right now, and if they need any help, you know, your department and departments all over the country and different counties are doing so much. So I just hope you know, people search to see if they're eligible and get the help they need. So I just want to thank you for the work you do and for coming on and just helping share some of, you know, the statistics and programs so people are just more aware of what's available to them. So thank you so much for taking the time.
Thank you very much for giving me the opportunity to talk about our social services programs.